Hello, and welcome to the new County Health Rankings and Roadmaps website tour. My name is Karen Odegaard, and I am a community coach with the County Health Rankings and Roadmaps program. I will be your tour guide today as we take a look at our updated website. We're going to start with just a few slides to get us grounded, and then we'll move over to the website and spend most of our time there today. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We'd also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. I'm also joined today by my colleague, Allie, who is also a community coach. Hi, Allie.
Hi, Karen. Great to be here with you and our audience today, and I'm looking forward to connecting using the chat and poll function throughout this tour.
Great. Speaking of which, Allie, can you walk us through how the chat and the questions works here in Zoom?
Yeah, let's take a look at that. And we just had a video that walked through this, but we'll just emphasize it again. So let's start with submitting questions. If you want to submit a question to any of the panelists, simply click on the Q&A control. When you do, the Q&A box will open up. Simply type in your question here, then click Send to submit your question. Send in your questions to anyone at any time. Next, I want to tell you about the chat feature. Use the chat to make comments or respond to questions that we may ask you. To use the chat feature, click on the chat control. When you do, the chat box will open up. And simply type in your comment here. Then press Enter to submit your response. Remember, chat is used to make comments or respond to questions we may pose to you. Use the Q&A function to ask your questions of us.
Thanks, Allie. So let's get started. We know that health is more than what happens at the doctor's office. At County Health Rankings and Roadmaps, we use the image that you see here to show that a wide range of factors influence how long and how well we live. Things like education, income, what we eat and how much we move, the quality of housing and safety of our neighborhoods. For some, the essential elements for a healthy life are readily available. But for others, the opportunities for healthy choices are significantly limited. We are working to change the conversation around what health means and to help communities bring people together to look at the many factors that influence health, to select strategies that work to improve health, and to make changes that will have a lasting impact. To do that, we provide data to reveal the factors that influence health, evidence to highlight the strategies that work, guidance to put those strategies into action, and stories of the real-world experiences to inspire and inform your efforts. Our new website makes it easier for you to connect to these different supports so that you can find what you need when you need it.
Great, Karen, and I'm going to jump in here with a quick poll, and we just want to hear from our audience how they use County Health Rankings and Roadmaps. So we've launched that poll, and we'll give folks about 6 or 7 more seconds. We've got some great answers coming in. All right, and I'm going to close our poll in 3, 2, 1. All right. So it looks like the majority of our audience is familiar with the data and then sort of split between evidence, guidance, and stories.
Well, that's great. I'm hoping that today, as we go through this, you'll find some new ways that you can use, again, that data, the evidence, the guidance, and the stories to support your work. So let's head over to the website. Okay, so first of all, I wanted to just note that if you are at a computer where you're able to navigate the website yourself on maybe a second screen while you're on today's webinar, you may want to follow along. If you get stuck, feel free to use the chat box and we'll get you reoriented, or just sit back and follow along on the screen here. So first of all, I want to note the orange navigation bar here at the top. This orange navigation bar will stay with you throughout your visit to countyhealthrankings.org. So we're gonna start by walking through it. On the far left, you'll see Explore Health Rankings. This helps to answer questions about what and why we rank. It's your go-to place to dive into the data. Next, you'll see Take Action to Improve Health. This helps to answer questions about what action you can take, how to take action, and who to work with. This page connects you to evidence and guidance. Then we have Learn from Others, which connects you with stories of what other communities are doing to inspire action. And What is Health brings it all together to tell the story of what we do and what health and health equity means to us. As you scroll down our homepage, you'll notice a similar path from the rankings data to the evidence presented in What Works for Health, to guidance for taking action, and a featured story to inspire and inform. So I'm going to scroll back up to the top, and we're going to dig into that orange navigation bar a little further. I'm first going to click on Explore Health Rankings. Explore Health Rankings helps to answer questions about what and why we rank. It's your go-to place to dive into the data. This page brings all the rankings content you're used to together in a new landing page. It makes it easier to find our reports and guidance on using data. And then I'm going to go over to the right side of the page where you'll see that you can also use this page to, again, learn more about using the data. And then in the center, sorry about that, you can use this page to access your county's rankings data by using the search bar here in the middle. I want to point out just a couple of key resources that you may want to explore on this page. So we highlighted the Use the Data section, and this guide actually helps you find and understand the data, both on our site and beyond, so that you can use it to move to action. Further down, you'll see Why Ranks Change here in the center. This page lays out some of the key reasons ranks can improve or worsen. From there, you can explore links to additional guidance about understanding rankings trends and measuring progress.
Karen, that's great. It seems like this could be a really helpful page to help communities unpack what we rank and why. And I can imagine some of the communities that I work with coming back as they prepare for the 2018 rankings release.
Yeah, I think that's a great point. Like I said, this is really bringing together the content that folks are used to, and it packages it all together in a nice common place so that you can come in and find exactly what you're looking for around using the data and finding your own rankings data. So I think it's a great place to make sure you come back to right around rankings release. I'm going to move across this navigation bar now to the Take Action to Improve Health page. The Take Action to Improve Health page helps to answer questions about what action you can take, how to take action, and who to work with. This page connects you to evidence and guidance. This page also provides links to learn more about our community coaches, a team of folks who are here to help you strengthen your community's efforts to improve health. You can link back to your county's rankings and take a look at the Take Action cycle, which is a foundational model for how and who of taking action. Our action and partner centers are grounded in this cycle. So if we head back up, we're going to go a little deeper into taking action to improve health. And I'm going to click right here on the left into What Works for Health. Evidence matters. Our What Works for Health tool helps you find policies and programs that are a good fit for your community's priorities. This page provides a menu of evidence-informed strategies and helps to answer the question, what can we do? It's now easier to find strategies by topic or keyword. You may recognize these health factor areas from our rankings model: health behaviors, clinical care, social and economic factors, and the physical environment. Now, we haven't changed the great information we provide about evidence for policies and programs. We just make it easier to get to it. So let's take a quick look, for example. If I click on housing and transit, which is under the physical environment, we see that we get 35 results. From here, I can still filter my results by health factor, by approach, decision makers, or evidence rating. And if I click on a strategy, like bike and pedestrian master plans, for example, we'll still find the expected beneficial outcomes and other potential beneficial outcomes. We'll find the evidence of effectiveness, which lays out what we really know about the evidence for this particular strategy. You'll see our impact on disparities rating, and then implementation examples and resources. I'm going to scroll back up. And now I'm going to use these handy breadcrumbs right here to get myself back to the What Works for Health landing page. We want you to make the most of What Works for Health, so we've provided quick access to guidance for using What Works for Health and for choosing your strategy. You can also still dig into our ratings, our methods, and our sources from our What Works for Health page. We'll also use this page to feature strategies and to direct you to stories of communities in action and What Works for Health reports. And again, I'm going to scroll back up to the top, and I'm going to use that navigation bar to take me back to the Take Action to Improve Health page. Next, we're going to head into the Action Center. The Action Center provides step-by-step guidance and tools to help you move with data to action. This page answers the question, how can we take action? The steps on this page provide a path for taking action. As a reminder, these steps are grounded in our Take Action cycle. For those of you who are familiar with the Action Center, you'll recognize the steps are the same, but the layout has a more engaging look and feel. The action steps are arranged in a linear fashion, but action isn't always linear. Sometimes these steps are going to overlap, and you may find yourself moving back and forth between these steps. That's okay. We want you to revisit these steps to find the right resources when you need them. In each action step, you'll find key activities and suggested tools to guide your progress. And no matter what your process looks like, we know that work together and communicate are foundational to your efforts. So we've included guidance for both of those here as well. Let's take a look at an action step. I'm going to click into Assess Needs and Resources. So here you'll find an overview of the step and its purpose. You'll find the list of key activities that make up this action step. You'll find up to 5 tools for each step. These are our favorite tools for this step, but you can still find additional relevant tools in each key activity as well. And in some steps, you'll also find a shortcut. This is a 2-page PDF that provides a quick primer on the step. From here, you can also navigate to the other steps in the Action Center. So if we click into a key activity, I'm going to just click on this first one here, review your county health rankings data. And when you do, you'll find related guidance and tools for that key activity. Now we know that the action steps include a lot of rich information, so we've added some navigation elements to help you keep track of which action step. You can see up here, we're in Assess Needs and Resources, which action step you're exploring, and where you are in the key activities. If we look down the left side of our screen now, we'll see that we can tell that we're in Review Your County Health Rankings data. But we can also see what the other key activities are and use this navigation on the left to move us further into the guide to that specific key activity. Now, I like to think of these pages, these key activities, as a destination page. When you get here, it's time to find the key activity that resonates most with you, and then review the guidance that you find and look for a tool or two that you can take with you. I'm going to head back up to the top of this page, and then I'm going to head on back to the Take Action to Improve Health page. So we have one more stop in the Take Action to Improve Health section, and we're going to go next to our brand new Partner Center. I'm going to click here. If you're a regular visitor to countyhealthrankings.org, you may recall that we had a set of partner guides that were part of the Action Center. We have completely revamped these guides based on feedback that we've heard from communities and partners. We've also given them their very own home in the Partner Center. The Partner Center is all about joining with others to make lasting change in your community. This page answers the question, who should we work with? Think about the people in your community who make positive changes happen. We can call them leaders, change makers, or stakeholders. Whatever you call them, though, these are the folks that you want to be partnering with. The Partner Center provides guidance around why people who play different roles in their community should care about working toward a healthy community, what they can do, and how you can engage them. Many of us play different roles in our communities. We may work in healthcare, but also serve on a government board. We may work for a nonprofit that also serves as a funder. And we are all community members. So let's start there. I'm going to click into community members. When you click on a guide, you'll find a brief introduction to the sector. And then you can see that in this guide, we specifically are answering the questions, why should community members be involved in building healthy communities? What can community members do to build healthy communities? And importantly, how can you connect with community members? We've tried to keep these guides fairly concise so you can get to the most important information that can get you started reaching out to new partners. I'm going to scroll back up to the top here and then head back using, again, those handy breadcrumbs back to the Partner Center. Now, the Partner Center page also includes some high-level tips for reaching out to new partners, which you'll find further down on this page. Use the Partner Center to learn more about the roles you play in your community and to explore other sectors you might want to partner with.
Great, Karen. Thanks for that walkthrough of this section on Take Action to Improve Health. And we've got a second poll that we're going to launch here. And this one is asking you which partner guides are you most interested in checking out, and you can select multiple answers. And as folks are sharing their responses, I'd also say keep sending in your questions. We're getting some great behind-the-scenes questions about how to dig a little deeper into the sites that Karen's walking through. So we're happy to answer those as they arise. All right, and we're going to close the poll in 3, 2, 1. And I'm going to share the results. I'm going to say it's pretty split. I mean, community development comes out a little bit ahead of the others, but overall, that's a pretty even distribution.
Well, this is great. And again, we tried to keep these guides fairly concise, so there's no reason you can't dive into a couple of them to get some insights into how you might reach out to those folks or for yourself in your own role in your community. Thanks for that, Allie. We're going to move on to learn from others. Learn from others connects you with stories of what other communities are doing to inspire action. This page brings together content from across the site that can help visitors learn from others. Here you'll find our webinars page, where you can register for upcoming webinars or watch archived videos. And then over on the right-hand side here, you'll see community highlights, where you can read about diverse journeys communities have taken in planning and implementing programs and strategies to create healthier communities. I also want to highlight this page, the pages that we have on the RWJF Culture of Health Prize, which is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. The prize honors and elevates communities that are dedicated to ensuring all residents have the opportunity to live the healthiest life possible. And this new page features updates and stories from prize-winning communities and summarizes the characteristics shared by communities that are catalyzing and sustaining positive change. These characteristics are reflected in the criteria for the prize competition, which include defining health in the broadest possible terms, committing to sustainable systems changes and policy-oriented long-term solutions, creating conditions that give everyone a fair and just opportunity to reach their best possible health, and harnessing the collective power of leaders, partners, and community members, as well as securing and making the most of available resources and measuring and sharing progress and results. And if we scroll further down, we'll find an interactive map of all 35 prize-winning communities. You can click on the map to learn more about each community's story. And we're going to head back to the Learn from Others page. This page also includes Working with Others, which provides information about the vibrant relationships we rely on to strengthen our work. Research findings with links to peer-reviewed articles featuring county health rankings. And our Peer Counties tool, which helps you find counties similar to yours based on key demographics, social, and economic indicators.
Great, thanks, Karen. And now we'd like to ask our audience members to use the chat box and share a little bit about how they use stories to support their work. So again, if you open up your chat box, you should be able to type in your responses and just share with us how you use stories to support your work. And Karen and I, in planning for this, I had a chance to reflect a little bit on this question, and some of the things that came up for me is that, you know, stories really help support data and tell the whole story and make the work come alive. Stories also create curiosity and that desire to hear and learn more from others and help find common ground.
Yeah, Allie, I'll just add to that I think one of the key things that stories can do, and one of the reasons that we wanted to make sure we include this here, is that data gives us a really great view of a community, but stories help us remember that there are people behind that data. So I love the combination of using data and stories together, and I'm eager to hear what some of our attendees have to say about that.
Yeah, I think echoing a lot of what you just said, you know, numbers or data are helpful for some, but stories personalize the work and motivate action. I think that's a great point. All right, well, I know we've got a couple more stops along the website tour, Karen, so why don't I turn it back over to you?
Great. So I'm going to take us to our final spot on the main navigation bar and check out What is Health. What is Health brings it all together to tell the story of what we do and what health and health equity mean to us. It gives some additional background about why we do what we do here at County Health Rankings and Roadmaps. And again, reiterates the work that we do around data, evidence, guidance, and stories. And finally, I want to make one other stop up here in the top hand right corner. You can see news and events. And this is a page that helps us keep things fresh. This is going to be your go-to page to find out what's new with County Health Rankings and Roadmaps. And we'll feature updates, webinars, blog posts, and include our social media feeds here. And now I'm going to take it back to our main homepage. Allie, I think you have one more poll. Is that
Yep.
right? Do I remember
Yeah,
that?
sorry about that. I was getting off of mute there. My apologies to everybody. We've got one last poll, and we'd ask, looking forward, what part of the site overall are you most excited to explore further? And so we've launched that poll, and we'll give everybody a few seconds here to jump in with their answers, and really appreciate all the audience joining us and participating in the polls and the chat about how they view stories. All right, and we're going to close the poll in 3, 2, 1. I'll share these results. So it looks like folks are really excited to explore the Take Action to Improve Health section, as well as continuing to use the rankings and learning from others. So that's great. We appreciate that feedback. So Karen, I think now we're getting ready to do some Q&A, and I know one question that came to us during the registration that I think can kick us off is maybe just share a little bit more about what led us to the redesign of the website.
Yeah, I think that's a great question, and I'm actually really glad it follows this particular poll. One of the things that we realized as we started taking a look at the site, and based on some of the feedback that we've heard from communities over the years, is one, that we felt like it needed a refreshed look and feel. But two, that part of the story of county health rankings and roadmaps that wasn't getting as much attention, that people weren't noticing as much, was the questions that are answered through that Take Action to Improve Health page. Getting people connected to what works for health so they can understand what they can do. Getting them connected to the Action Center so they can understand how they can take action, and the Partner Center to understand who they should be working with. And as we thought about how we could better tell our story, we really felt like we could be really bringing that pivot from data to action, making that more prominent and bringing that to life more clearly on our site. And so that was one of our big goals with this redesign, and was really informed, I think, by just the work that we do with communities and hearing from folks that, as we see reflected here, hadn't necessarily gotten in and explored those different resources for taking action. So I'm happy to see those poll results, and I think that really indicates what was driving some of these changes.
Great, thanks, Karen. So I just want to take this opportunity to remind folks that if they do have questions, to share them with us via the Q&A box, and we'll be happy to get to those. This was another question that came in, and it's in addition to the partners that you mentioned during the tour of the partner guide section, we know that there are many others working on improving the health of their community. What should somebody do if they don't see their specific sector listed, or how might they go about beginning their exploration and search?
Yeah, so I'm just going to move into the Partner Center for a moment to think about that. I think the world is made up of so many sectors, and we can't accommodate them, or we can't include them all here, because then it would, that would just be overwhelming. And so what we want people to do, if you come in and you don't see your job, your role in a community reflected explicitly here, I think you can think about either those general questions that we're trying to ask. Why does it matter to you? Why does it matter to you if, why is health important to you? And then starting to think about what you can do, and who else you might want to be reaching out to. And the other thing I would say is that we are all community members. And so if you don't see your particular work reflected here, I would say start with the community members and find out what you can do as a community member, who else you may want to be reaching out to get engaged in this work in your community.
Great, thanks, Karen. So we've got a question here, and let me read through it, and then between you and I, maybe you can kick us off and we can thought partner on a response. How should communities who want to spark change think about innovation when maybe there's little community or city budget? And so specifically looking for resources on how to raise awareness and securing resources and funding.
Mm-hmm. So I'm curious where you go with that, Allie, but the thing that comes to mind to me is, again, thinking about that partner center and thinking about the relationships that you can be building in your community to raise awareness, to engage people in these conversations, to bring together the collective power of lots of different people from different walks of life. So it's not just reliant on one sector, the government sector or public health sector, to figure out how to develop the resources or find the resources to make changes in your community, that you can really be bringing people and the resources that they can bring from various sectors and roles in your community. So I think, to be a little more concise, I think it begins with relationship building and raising awareness among people that you could be partnering with in this work.
Karen, I think that's great, and my addition would then be to pivot back to the action steps and look at the communicate guide and work together guide for some guidance around how to move forward.
Yeah. And I'll just take a peek into those while we, if you have another question, Allie, I'll just share these on the screen so you can see in Work Together the types of key activities we have here. And then I'll also show the same thing in Communicate. But I think some of the ideas about recruiting diverse stakeholders can help, and building relationships can help you think about how do you develop those relationships. And then in Communicate, I think especially around developing your message and using the power of story, delivering your message, all of these I think can be really critical as you think about how do you go out and raise awareness, bring people into the work with you. Start the conversation is another good one to start with.
Great, Karen, and I think this might be our final question. I'm not seeing a lot more coming in right now. And this question was asked a couple of times today by a couple of different people. Do we know the date of the 2018 County Health Rankings release?
Good question. We don't have the official date ready to release yet, but we release the rankings in March, and I think we'll be releasing this year in March again. I don't think we're quite in a place to have a specific date yet, but keep watching for it.
And I was going to say, connect with us via social media or sign up for our e-newsletter. Those are great ways to stay connected and find out as soon as we announce the date.
Yep. And if you want to sign up for our e-newsletter and you haven't done that yet, I'm going to use this screen to show you that you can scroll all the way to the bottom on any page on the website to find our bold blue footer, and you can sign up right there for emails and also find out how to follow us on social media right there as well. All right. Well, I will close by saying thank you so much for joining us for this web tour and for taking some time to explore the new County Health Rankings and Roadmaps website with us. Please use the, I'm going to scroll back down again one more time really quickly. Please go ahead and use this Contact Us button anytime you have a question. If there's something that you're used to, that you've used in the past and you're just not finding it when you're exploring the new site, let us know and we'll be sure to get you to what you need to find or what you're looking for. Otherwise, I say go forth and explore our site some more, and please let us know what you like, what you think we could improve, and what's missing. So we look forward to your feedback. Thank you so much.
Thanks, everyone.